Healthcare isn't broken, it's designed this way. The United States spends more on healthcare than any country in the world, and yet we are not the healthiest. Insurance premiums rise, hospital bills explode, prescription drug costs 5 to 10 times more than overseas. At some point you have to ask, is this incompetence or is this the business model? What if American healthcare isn't failing? What if it's functioning exactly as structured? Not as a care system, but as a revenue system. Because once you follow the incentives, not the marketing, the picture changes completely. This isn't chaos, it's alignment, and alignment produces predictable outcomes. Let's simplify the system. 4 major power centers: hospital systems, insurance companies, pharmaceutical manufacturers, pharmacy benefit managers, or PBMs. Now add private equity firms, medical device manufacturers, data analytics vendors. This isn't a healthcare network, it's a financial ecosystem, and every player optimizes for one thing: predictable revenue. Hospitals get paid per procedure, not per outcome. So what gets prioritized? More tests, more imaging, more surgeries, more admission, preventative care, nutrition and counseling, long-term lifestyle management, low reimbursement, low margins. The system doesn't reward health, it rewards billable events. And billable events scale. Insurance companies collect premiums. Their profitability depends on controlling payouts, managing risk pools, negotiating down reimbursements, investing in premium float. They're not structured to eliminate disease. They're structured to price risk and preserve margin. Every pre-authorization, every claim review, every network restriction, it's cost containment, not care optimization. Let's talk about insulin. Insulin was discovered in 1921. The original patent was sold for $1, so it could remain accessible. Yet over the last 2 decades, insulin prices in the United States skyrocketed. Major manufacturers, including companies like Eli Lilly, raised list prices repeatedly. At one point, insulin in America cost up to 10 times more than in other developed nations. Why? Because of the rebate system. Manufacturers set high list prices. PBMs negotiate rebates. Insurers use those rebates to offset premiums. Patients without strong coverage, they pay based on the inflated list price. The complexity allows each layer in the chain to extract margin. Until public outcry forced price caps in 2023, the system didn't self-correct and responded to pressure. That's not market efficiency, that's reputational containment. And insulin isn't an outlier, it's a blueprint. Now let's talk about what almost no one discusses: consolidation. Over the past 20 years, hospital systems merged aggressively. Independent hospitals acquired. Small physician practices rolled up. Private equity entered emergency medicine, anesthesiology, dermatology, hospice. Why does this matter? This healthcare demand is inelastic. You're having a heart attack? You don't comparison shop. Consolidation increases bargaining power. Less competition means higher negotiated rates. Those rates get passed to insurers. Insurers pass them to employers. Employers pass them to you. Premiums rise, deductibles rise, everyone blames costs, but costs are driven by leverage. The United States spends nearly double per capita to peer nations, but we don't have double the care, we have double the administration, building governments, compliance teams, utilization review, coding specialists, appeals management. Entire careers exist just to navigate billing friction. Complexity becomes a moat. The harder the system is to understand, the harder it is to compete against. Opacity protects incumbents, and as you know, most healthcare spending goes towards chronic disease, diabetes, heart disease, obesity. Chronic disease means recurring prescriptions, specialist visits, monitoring, hospitalizations, and create recurring revenue. Preventative health, lower margin, lower scale, less monetizable. The system is optimized for intervention, not prevention. Healthcare represents nearly 2/3 of the US, 20% of US GDP, one of the largest sectors of the economy. Every major player depends on the current structure. Hospitals rely on procedure volume, pharma relies on patent protection, insurers rely on premium growth. Investors rely on healthcare as a defensive sector. Meaningful reform would disrupt public company earnings, pension fund portfolios, private equity returns, state budget tied to hospital networks. That creates resistance, not because of ideology, because of capital exposure. This isn't a conspiracy, it's aligned incentives. Who benefits? Large hospital systems, major insurers, pharmaceutical manufacturers, healthcare investors. Who absorbs the friction? Patients. Employers, dependent physicians, families carrying medical debt. The system persists because it is profitable, not because it is optimal. Healthcare in America isn't chaotic, it's engineered not to maximize health outcomes, but to minimize revenue stability under regulatory constraint. Until incentive shifts from volume outcomes, from opacity to transparency, from consolidation to competition, the trajectory won't change. Premiums will rise, complexity will grow, and the narrative will remain. It's complicated. It is, but it isn't accidental.